And first we'll be hearing from one of our KCA affiliates from the HLRCC Foundation, Dean Elhag.
Hi, everyone. My name is Dean Elhag. I'm a hematology oncology fellow at the University of Iowa, and I'm also the president for the HLRCC Foundation. Thanks for having me here today. I really appreciate the opportunity to speak with you guys. So we are a U.S. nonprofit organization. Patients are at the center of our work, and our reach extends to 1,000+ families affected by HLRCC within our network. So our mission is to increase patient advocacy, awareness, and research in HLRCC. So we work with a number of patient advocacy groups, institutions, academic centers, some of whom are listed here. So I know I'm speaking in front of kidney cancer experts from across the world, so I won't belabor this, but I think there's some interesting facts about HLRCC, and there's some potential opportunities to create more awareness and opportunity to identify patients to undergo their annual abdominal MRIs. So this is a genetic condition, fumarate hydratase mutation in the germline sense. And it affects multiple organs. There's skin manifestations, uterine manifestations. I'll talk a little bit more about that. And then there's this increased kidney cancer risk. Some new genetic research has come out showing that this actually is not as uncommon as we previously thought. So if you go on Google and type in how common is HLRCC, you'll find 300 families worldwide, but as you can see within our own network, we probably have more than that. Some new genetic studies have shown that possibly 1 in 2,500 people might have this condition. So that creates immense need to identify these individuals here in the US. And I know during my medical school training, I didn't learn about HLRCC, but it would, be classified amongst these syndromic hereditary kidney syndromes such as VHL, BHD. So hopefully increasing some of this awareness. There's this increased risk of this aggressive form of kidney cancer, and a lot of patients, they present de novo metastatic. And it affects a young population. So it's, it's imperative to kind of identify these individuals. I'll give you an example. This is not a HIPAA violation, this is a public story. But this young man, 18, 19, found out a family member had HLRCC, so he's getting ready to go to college. He ends up, I'll just do the genetic testing, he ended up being positive for HLRCC. And then he got his abdominal MRI, and they found a small renal tumor. And then he had resection. It turned out to be FH deficient RCC, or papillary type 2 RCC, and who would have known, what have happened if he had, hadn't known about this condition and gotten his MRI and surgery. So he's doing well years out, and hopefully will continue to do well. So I just wanted to highlight some of the key manifestations about the condition. There's an opportunity here as medical oncologists, et cetera. When you have a family, somebody that comes in at a young age, that has a non-clear cell subtype of RCC or a family history of RCC. The family history it can be helpful, and who should be screened for genetic testing. Another interesting fact: these individuals develop these skin leiomyomas, also more specifically piloleiomyomas, which are smooth muscle tumors within the hair follicle, and they, when you have goosebumps, they rise up. But these individuals happen to get these smooth muscle tumors, and it can be an opportunity if they come to their primary care provider or dermatologist. They look pretty benign. Sometimes they can be painful. Sometimes they can be asymptomatic. But there's an opportunity to educate primary care providers, dermatologists, pathologists, on what to look for, and if there's need for genetic testing. There's a lot of variability with that. So some people can have 1 or 2, some people can have none, some can have many, and when they have many, it's virtually pathognomonic. Uterine leiomyomas, or uterine fibroids, of course, is pretty common amongst the general population. But in a young woman that presents with a lot of bulky fibroids, especially at a young age, it may be an opportunity, especially amongst the OB-GYN providers. So we really appreciate this opportunity to work with the Kidney Cancer Association. We just partnered and are an affiliate, so we're really excited to continue to develop this relationship over time. If you have any questions, please feel free to reach out, deanelhag@hlrcc.org. Also, I have a university email. I just wanted to highlight that we have a new updated kind of website, hlrcc.org. We have an FAQ, video animation, some resources for patients and clinicians alike. I know it's not the most common condition, but it's a good starting board. And it can help, if you have patients with HLRCC, to kind of get them plugged into our network. A lot of patients have felt sometimes that they don't have the resources and community, but we fortunately have a very active community, and so I think that's a great opportunity. Thank you so much.